Welcome to the deep dive, everybody. Today we're diving into some excerpts from medical textbooks all about HIV and AIDS.
Right.
We're going to try to break it down, figure out how it works,
Yeah.
all the important stuff, the impact, what you need to know, all that good stuff. And, it's a global pandemic, right? Millions of
Wow.
people are affected.
Right.
34 million people infected, according to the World Health Organization. But get this, the mortality rates, they've dropped
Yeah.
by 23% since 2010. What's up with that?
That's a really, really good point to start with
Mm-hmm.
because it really speaks to how much progress has been made,
Yes.
especially with these antiviral treatments,
Yeah.
like antiretroviral therapy,
Oh, yeah.
RT. But before we jump ahead, let's just make sure we all understand like the basics.
Yeah.
What's HIV? What's AIDS?
Okay. Yeah, that sounds good. So HIV and AIDS, a lot of people, I think, use those terms interchangeably,
Yeah.
but they are distinct.
Right.
Yeah.
Yes, absolutely. So HIV stands for the human immunodeficiency virus. So that's the actual virus.
Mm.
AIDS is acquired immune deficiency syndrome. So that's the most advanced stage of the infection
Got it.
by HIV.
Okay, so that clarifies things a bit. And I know there are different types of HIV.
Yes, there are.
Is that true?
There are. Yeah. So there's HIV-1, that's the most common type
Yeah.
globally,
Mm-hmm.
especially in the U.S.
Mm-hmm.
And it's known for HIV-1 mutates really rapidly,
Mm-hmm.
which is one of the things that makes treatment a little bit more complicated. And then there's also HIV-2, which is less common and it's less transmissible. It's mostly found in West Africa.
Got it.
Yeah.
Okay, so HIV-1, I feel like that's the one we hear about most often.
Yeah.
But how does this virus, how does it work?
How does it attack the body?
Yeah, what's it doing?
So HIV is really interesting because it's what we call genetically incomplete. So it can't reproduce on its own. It needs to hijack our cells to survive. Specifically, it attacks what are called T cells, which are these really important cells for our immune system. So without T cells, we can't fight off infections as well.
So it's kind of like a parasite or something.
That's a perfect analogy. Yeah, it's like it sneaks into a T cell.
Sneaky.
Yeah, very sneaky. And it uses its own enzymes to kind of turn the cell into an HIV factory.
Oh, wow.
Yeah. And these enzymes, by the way, these are really important because they are targets for the main drugs that we use to treat HIV.
Okay.
And those enzymes are called reverse transcriptase, integrase, and protease. Big words, I know.
Yeah.
But those are the ones that are targeted by the antiretroviral drugs.
So it's basically, HIV is using our own cells
Against us.
against us to spread itself.
Spread itself, exactly.
That is scary. So how is it transmitted then? I think there's still a lot of confusion out there, right? There is.
Yeah. It's important to be really clear about this. It's only transmitted through specific bodily fluids, blood, semen, vaginal secretions, and breast milk. So, you can't get it from just casual contact, like shaking hands or hugging or things like that, or sharing utensils.
Okay. So no casual contact. Got it.
Exactly.
But what activities would be considered high risk? What should people be aware of?
The biggest ones are unprotected sex, having multiple sexual partners, and then sharing needles
Okay.
if you're, injecting drugs. Also, there is the risk of mother-to-infant transmission during pregnancy, childbirth, or breastfeeding.
Got it. Okay, so knowing those risks is really the first step in prevention. Speaking of prevention, what role do nurses play?
Oh, huge.
Yeah.
On the front lines of all this.
Yeah.
So nurses are the ones that are educating their patients about safer sex practices. They're encouraging them to get tested regularly for HIV and counseling them about, risk reduction, how to reduce their risk. They're also the ones who are, protecting themselves, making sure they're following all the standard precautions, like wearing gloves and, disposing of sharps properly.
Right, of course. That makes sense. So we've covered what HIV is, how it's spread, how to prevent it. Let's talk about AIDS now. What does it actually mean when someone has progressed to that stage?
So AIDS is diagnosed when the immune system is very weakened.
Mm.
And the way we measure that is by looking at what's called a T cell count. If the T cell count gets really low, that's a sign that the immune system is severely compromised. But it's not just the number. People are also considered to have AIDS when they develop what are called opportunistic infections or cancers. So these are infections or cancers that wouldn't normally affect someone with a healthy immune system.
Mm.
But because the immune system is so weak, they're able to kind of take hold and cause a lot of damage.
So their body is basically more vulnerable to a whole bunch of other illnesses because that immune system is so weak.
Exactly.
Can you give some examples? What are some of those specific AIDS defining illnesses, I guess.
Yeah. So one that a lot of people may have heard of is Kaposi sarcoma. That's a type of cancer that often presents as these kind of red, purple, or brown patches on the skin
Mm.
or mucous membranes. Another common one is pneumocystis pneumonia or PCP.
Mm.
That's a serious lung infection. That causes difficulty breathing.
Oh, wow.
Yeah.
Those sound really, really serious. Are there other, like, important things to know about just, like, living with HIV and AIDS?
Well, I think one of the important things to understand is how the infection progresses.
Mm.
So in the early stages of HIV infection, people might experience what's called acute retroviral syndrome,
Mm-hmm.
and that often feels a lot like the flu.
Okay.
So you might have fever, swollen lymph nodes, a rash, and it's easy to kind of miss it or mistake it for something else. This is why testing is so important.
Yeah, it's easy to just brush it off as like, oh, I have the flu.
Exactly.
So early detection is, like, key.
Very key, yeah.
But how is HIV diagnosed? Like, what is the process?
So it's actually a two-step process.
Okay.
So first, there's an initial screening test. There are a few different types of those. And then if that screening test comes back positive, then a second, more specific test is needed to really confirm the diagnosis.
Got it. So it's like a two-pronged approach to make sure that the diagnosis is accurate.
Exactly.
Yeah.
It's very important to confirm.
What happens after someone's diagnosed?
Yeah.
What does that look like? How is it managed?
So that's where antiretroviral therapy, or RT, comes in.
Okay.
These are the medications that are specifically designed to target the virus.
Okay.
And they do that by targeting those enzymes that we were talking about before.
Okay, so the ones that HIV uses to replicate itself.
Exactly.
So it's like it stops the virus from multiplying.
Exactly.
Yeah.
It's trying to suppress the virus as much as possible and prevent it from doing further damage to the immune system.
Yeah.
And the way we use ART has actually evolved a lot over time. We used to use single drug therapies,
Okay.
but now what we do is we use combination therapies,
Got it.
like highly active antiretroviral therapy, or HART.
The heart. Okay.
And that's basically using a cocktail
Okay.
of different ART drugs
Okay.
to really hit the virus hard from different angles.
That makes a lot of sense. So tell me, what are the goals of treatment? What are they trying to achieve?
So the ultimate goals are to maintain what's called a healthy CD4 count. So that's a measure of those important T cells.
Okay.
Remember, those are the ones that are attacked by the virus.
Yeah.
And then we're also trying to achieve what's called an undetectable viral load.
Okay.
So an undetectable viral load means that the amount of HIV in the blood is so low that it can't even be detected by our standard tests.
So undetectable means, like, it's still there,
It means the virus is still there,
but it's suppressed.
but it's suppressed, exactly.
But it doesn't mean the person is cured. Right.
It doesn't mean that they're cured, but it does mean that they can live a much healthier life.
Okay.
And importantly, if their viral load is undetectable, they're much less likely to transmit the virus to others.
Okay.
So it has a huge impact on public health as well.
That's great.
So with consistent treatment, people with HIV can live long and healthy lives.
That is good to hear. I'm glad to hear that. We've covered a lot, I feel like we covered a lot of ground here.
Yeah, we have.
We've talked about the basics of HIV, how it's transmitted, how it's diagnosed, how treatment has evolved. But I know that there are challenges and complications too.
Absolutely.
So can we talk about those?
Yeah, definitely. One of the biggest challenges we face is what's called drug resistance.
Okay.
So over time, the HIV virus, like any virus, can mutate. And sometimes those mutations can lead to the virus becoming resistant to the medications that we're using.
Oh.
So that's a huge challenge.
It seems like it's this constant battle.
It is. It's a constant battle of trying to, stay one step ahead of the virus.
Yeah.
And the virus is very smart.
Yeah.
So that's one of the reasons why doctors often have to order very specific tests
Okay.
to kind of figure out the best way to treat each person.
Okay. Makes sense. So apart from drug resistance, are there other things?
Well, there's the increased risk of what we call opportunistic infections.
Okay. Yeah. We were talking about those a bit before. So those are like what? Bacterial infections?
Yeah, they can be bacterial, they can be viral, fungal, even parasitic infections
Wow.
that basically take advantage of the weakened immune system.
So like in a normal person, they might not even be a problem.
Exactly. And someone with a healthy immune system, their body would just fight those off, no problem.
Can you give us some more examples? Like what are some of the infections and how are they treated?
Yeah. So one that can be particularly dangerous is what's called Mycobacterium avium complex, or MSC. It's a mouthful, I know.
Yeah.
It's a type of bacteria that's actually found in soil and water,
Really?
and it often causes very serious lung infections in people with weakened immune systems.
Soil and water. So it's kind of like all around us, but our immune system usually just deals with it.
Exactly.
Yeah.
Yeah, it's very common in the environment, but for someone with HIV, their weakened immune system, it can't fight it off as effectively. And treating MC can actually be very challenging
Hmm.
because these bacteria are often resistant to a lot of the antibiotics that we use.
I see.
So that's another layer of complexity.
Wow. Are there any other like particularly challenging ones we should know about?
Yeah, another one is toxoplasmosis. That's a
Toxoplasmosis.
parasite.
Okay.
Actually, a lot of people are infected with toxoplasmosis.
Really?
And they usually don't have any symptoms.
Okay.
But for someone with HIV, it can cause serious problems,
Hmm.
especially in the brain.
Brain infections. Oh my gosh.
Yeah,
So these infections are a huge concern for people with HIV.
they are. Yeah. But it's also important to remember that, with the right treatment and care, people can manage these challenges and live full and healthy lives.
Okay.
And this is another area where the role of nurses is really, really important.
Yeah, we've talked a little bit about the role that nurses play, but I'd love to like dive a little deeper. What are some of the specific challenges and rewards that they experience when working with HIV and AIDS patients?
It's definitely very demanding, emotionally demanding. Nurses in this field, they see firsthand the suffering that this disease can cause, not just for the patients, but for their families and loved ones. We're talking about a really complex illness. We're talking about these opportunistic infections, and we're often talking about a lot of social stigma, unfortunately, that still surrounds HIV and AIDS.
Right.
So it takes a very special kind of person.
Yeah, it sounds like it takes a very specific set of skills, I guess, and qualities.
Absolutely.
Uh-huh.
It takes someone with empathy, with compassion, with resilience, a really strong commitment to social justice.
So it's a lot more than just administering medication.
It is, yeah. It's about building relationships with patients, providing holistic care,
Yeah.
educating them, empowering them to take control of their own health.
It really sounds like a true partnership.
It really is. And one of the things that nurses often talk about is the resilience that they see in their patients.
Yeah.
They see their patients fighting for their health and well-being, challenging stigma, living full and meaningful lives.
Mm.
And that's really inspiring.
Yeah, it must be really rewarding then to see that,
It is.
to be a part of that,
It is.
that journey. Well, speaking of journeys, I think it's time for us to shift gears a little bit and explore kind of the frontiers of HIV and AIDS research.
Yeah, let's do it.
Like what's going on? What's new?
What's giving us hope?
What gives us hope? We touched on some of that before, right?
Oh, we did.
We were talking about like the search for a cure, advancements in treatment and prevention. But what else is going on out there?
So one area that I find particularly exciting is the development of new drug delivery systems.
Okay.
So researchers are always trying to figure out ways to make taking medication more convenient,
Yeah.
less disruptive to people's lives.
Right, because I remember we were talking about those long-acting injectables earlier.
Exactly.
Which seemed like a huge step forward.
Huge step. And it's not stopping there. They're working on implantable devices.
Implantable devices.
Yeah. So imagine a little device that's implanted under the skin that can release a steady dose of medication over an extended period. Like we're talking months, maybe even years.
What?
Yeah.
Wow, an implant that like releases medication?
Yeah.
That sounds like a sci-fi movie or something.
It does, doesn't
Yeah.
it? But it's a real possibility. And you can imagine how much that would change things
Yeah.
for people living with HIV.
Yeah.
The freedom, the peace of mind of not having to worry about taking pills every day.
Yeah, it would be liberating.
It would.
It sounds like the research is really pushing the boundaries of what's possible.
It is. It's very exciting.
Are there other areas that you think are particularly exciting in terms of research?
Another area that I think holds immense promise is personalized medicine.
Okay.
So researchers are really trying to understand the unique genetic and biological characteristics of each individual and how those factors might influence their response to treatment.
So it's like instead of this like one-size-fits-all approach,
Right.
it's more personalized, tailored
Exactly.
to the individual.
Yeah, we're moving towards this idea of really tailoring treatment to each person's specific needs.
Yeah.
And that could lead to much more effective treatment strategies, fewer side effects, and ultimately better outcomes for people living with HIV.
Wow.
Yeah.
It really feels like we're like on the cusp of a new era in in HIV and AIDS, like treatment and care.
It does feel that way.
Yeah.
But I think it's important to remember, as we celebrate all of these scientific advancements,
Mm.
that we can't lose sight of the human element.
Yeah, for sure.
At the end of the day, HIV and AIDS is not just about viruses and medications.
Yeah.
It's about people's lives, their hopes, their dreams, their fears, their loves. And those stories are just as important as the scientific breakthroughs.
Absolutely. I think it's so important to like hear those stories and really understand the human side of HIV and AIDS.
I couldn't agree more.
And I would love to hear some of those stories. Like what is it really like to live with this?
I think I know just the person to share those stories with us.
Okay.
Someone who has really dedicated their life to advocating for people living with HIV
Mm-hmm.
and has really seen firsthand all of the challenges and triumphs.
I'm excited to hear. I think
Yeah.
this will be really powerful.
I think so too. It's pretty amazing when you think about it, how far
Mm.
we've come with HIV/AIDS treatment. From those early days when it was just so much fear and uncertainty
Right.
to where we are now.
Yeah, it really is like a huge testament to, scientific research
Mhm.
and all the healthcare professionals that have worked so hard
Absolutely.
to get us where we are.
Absolutely. And, like we were saying before, we can't forget about the human stories
Right.
at the heart of all this.
Yeah, absolutely.
And speaking of the human impact, we were just talking about opportunistic infections.
Mm-hmm.
And those are the ones that, they kind of take advantage
Mhm.
when your immune system is weak
Right.
because of HIV. I think it's worth, really diving a little deeper into why there's such a problem
Yeah.
for people with HIV/AIDS.
Yeah, no, that's a good point. We kind of touched on a couple examples like MSE and toxoplasmosis.
Right.
But I'm curious to know a little bit more about like what makes them so dangerous
Yeah.
in the context of HIV.
Well, it really all comes down to the immune system.
Right.
So in someone with a healthy immune system, their body is usually really good at fighting off these infections.
Okay.
But for people with HIV, the virus has damaged their immune system,
Hmm.
which makes them much more susceptible to these opportunistic infections.
So their defenses are down.
Defenses are down, yeah.
Yeah. So they're more likely to get infections that, for a normal person wouldn't really be a problem.
Exactly, yeah. And it's not just that they're more susceptible, it's that the treatments for these opportunistic infections can be pretty rough.
Oh, okay.
A lot of times it involves taking a lot of different medications
Okay.
for a long time. And that can be really tough on someone who's already dealing with, the demands of HIV treatment.
So it's like a double whammy almost.
Yeah.
You've got your body fighting the HIV,
Yeah.
and then you've got these other infections on top of it.
Exactly. Plus, the treatments themselves can be pretty hard on the body, too.
Oh, wow. So it's really rough.
It can be, yeah. And it's not just the physical burden, There's the emotional toll.
Right.
Imagine, you're already dealing with an HIV diagnosis,
Mm-hmm.
which comes with, its own stress,
Yeah.
often stigma. And then on top of that, you get hit with a serious infection. That's a lot to handle.
Yeah, that must be so challenging. I guess it really speaks to the need for like a really holistic approach to care.
I think so, too.
Not just focusing on the physical, but also like, emotional,
But-
psychological well-being, all of that.
And that's really where nurses come in.
Right.
They're often the ones who are providing not only the medical care, but the emotional support, the education, the advocacy,
Mhm.
all of that.
Yeah, and we've talked about the role of nurses a bit, but I'd love to just like hear more
Sure.
about those specific challenges and rewards they face.
Yeah. Well, for starters, it can be very emotionally demanding. They're seeing firsthand, the suffering this disease can cause, not just for the patients, but for their families, for their loved ones. And like I said, we're dealing with a complex illness, the potential for these opportunistic infections. And, there's often still this social stigma around HIV/AIDS, which makes things even more challenging.
It sounds like a really tough job.
It can be.
So what kind of person do you need to be, I guess?
I think it takes a really special kind of person to be a nurse in this field. Someone with a lot of empathy, a lot of compassion, someone who's resilient, someone with a really strong commitment to social justice.
Mm-hmm.
Because you're really fighting for your patients on multiple levels.
Right. So it's more than just the medical side.
It is.
It's the whole person.
It's about building trust and rapport,
Mm-hmm.
advocating for their needs,
Mm-hmm.
providing support, education, throughout their journey.
Right.
It's a lot.
So it really is a partnership then.
It really is. But despite all those challenges, there are some really incredible rewards too. Nurses in this field, they often see some amazing things.
Oh, like what?
Well, they see the resilience of their patients. They see them fighting for their health, for their well-being, challenging the stigma, living full and meaningful lives. And that can be really, really inspiring
Yeah, I'd find
to
it.
be a part of.
It must be really rewarding to witness that kind of strength.
It is.
Well, speaking of journeys, I think it's time for us to move on to the next part of our journey,
I agree.
which is, we've talked about the human impact, we've talked about the challenges, the treatments. I want to talk about kind of the exciting frontiers of research. What's happening out there that's giving us hope for the future of HIV/AIDS?
Okay, yeah, let's dive into that. So we touched on some of this before, the search for a cure, advancements in treatment and prevention. But there's so much more happening.
Yeah.
One area that's really fascinating to me is the development of new drug delivery systems.
Okay.
Researchers are working really hard to make taking medication easier,
Yeah.
more convenient for people.
Right. And we talked about the long-acting injectables,
Right.
which seem like a big step in that direction.
A huge step.
Are there other innovative delivery systems that are being worked on?
There are. So, for example, they're working on implantable devices.
Implantable.
Implantable, yeah. Like imagine a tiny little device implanted under the skin that releases a steady dose of medication
Yeah.
over a really long time. We could be talking months. We could even be talking years.
Really?
Yeah.
Wow, that's incredible. An implant that just releases medication.
Yeah.
That sounds like something out of a sci-fi movie.
It does, doesn't it?
Yeah.
But it's a real possibility.
Mm,
And if it works, you can imagine what a game changer that would be,
right.
for people living with HIV. Not having to worry about taking pills every day. The freedom that would give them.
Yeah.
The peace of mind.
Yeah, absolutely. It would be liberating.
It would be.
It's amazing how, research is just constantly pushing those boundaries.
Yeah, it's really exciting. There's another area that I'm really excited about too,
Oh, what's that?
and that's personalized medicine.
Okay.
For a long time, we've had this kind of one-size-fits-all approach to medicine.
Right.
But now, researchers are realizing that every individual is different. They have their own unique genetic makeup, their own unique biological characteristics. And all of those factors can affect how they respond to treatment.
So it's like instead of giving everyone the same treatment,
Yeah,
you're tailoring it
exactly. We're trying to tailor it to each person,
to the individual,
to the individual, yeah.
to what their body needs.
Exactly, yeah. So we can find the most effective treatment for them
Mm-hmm.
with the fewest side effects and hopefully the best possible outcome.
It really does feel like we're on the edge of a whole new era
It
of HIV and AIDS treatment.
It does. It's very exciting. But I think it's also really important to remember as we celebrate these advances that we don't forget the human element.
Right, of course.
At the end of the day, HIV and AIDS is not just about viruses and medications.
Right.
It's about people.
Yeah.
It's about people's lives, their hopes, their dreams, their fears. It's about their love. And those stories are just as important as all the scientific stuff.
Yeah, absolutely. And I think it's so important to hear those stories.
I agree.
To really get a sense of what it's actually like to live with this.
Right.
To
Yeah.
really put a face to the disease. And I think I know just the person who can share those stories with us.
Oh, okay.
Someone who's dedicated their life to advocating for people living with HIV
Okay.
and has really seen, all of the challenges and the triumphs.
Yeah.
Yeah.
I'm really excited to hear from them.
Yeah. I think it'll be really powerful.
I think so too. It's been really interesting to go through all the science of HIV and AIDS,
Mm-hmm.
but I think I'm most excited to hear from our guest today.
Me too.
Because I think those personal stories really, really connect us to the human impact in a way that facts and figures sometimes just don't.
I totally agree. Hearing from someone who's actually lived with HIV, for years,
Yeah,
it's going to give us a whole new perspective.
absolutely.
It's a real privilege to have them join us.
Yeah.
So, would you like to introduce our guest? Absolutely. Today, we are welcoming Guest Name, who has been living with HIV for over 2 decades and is a powerful advocate for others living with the virus. So, Guest Name, welcome to the Deep Dive.
Thanks for having me.
Thank you so much for being here. We're so happy to have you.
Yeah, I think it's really important to share these stories and help people understand that HIV and AIDS is more than just a disease. It's a human experience.
That's a great way to put it. So, can you tell us a little bit about your journey? When were you diagnosed, and what was that time like for you?
I was diagnosed back in the late 90s. And back then, there was so much fear and misinformation about HIV AIDS. It felt like a death sentence.
Wow.
Yeah, I was overwhelmed. Feelings of isolation, shame,
Yeah,
just terror, really, about what my future was going to look like.
I can only imagine. I mean, that must have been so, so difficult.
It was.
What helped you cope?
Honestly, it was connecting with other people living with HIV. That was the turning point for me. I found a support group,
Okay.
and it was like this huge weight was lifted off my shoulders.
Mm.
It showed me that I wasn't alone and that there was life after diagnosis.
Mm.
That people were out there living full and meaningful lives with HIV.
That sense of community can be so powerful.
It really was. Just knowing that other people understood what I was going through physically and emotionally made all the difference. It gave me the strength to keep going, to fight for my health,
Yeah.
and to start challenging the stigma around HIV and AIDS.
That's so inspiring. You mentioned challenging stigma. Can you tell us a little bit more about your advocacy work? What are some of the key issues that you're most passionate about?
One of the things that's always been closest to my heart is fighting for access to healthcare and treatment for everybody living with HIV. It shouldn't matter what your background is, what your circumstances are. Everybody deserves quality care. It breaks my heart to know that there are still people out there struggling to afford their meds or facing all these barriers to treatment.
Access to healthcare is a basic human right.
It is.
And, it's so crucial for people with HIV to be able to get the treatment they need,
Absolutely.
to live long and healthy lives.
Exactly. And I'm also really passionate about education, especially for young people. We need to break down the silence and shame that still surround HIV/AIDS and empower the next generation to make informed decisions about their sexual health.
Yeah, I think education and awareness are just so, so crucial.
It is.
It's about giving people the tools that they need
Yeah,
to protect themselves and others.
absolutely. And finally, I think it's important to address the stigma. It's amazing how far we've come scientifically, but the social stigma can be just as damaging as the virus itself.
You're so right. Stigma can be devastating. It keeps people from getting tested, from disclosing their status, from seeking the care and support that they need.
Yeah.
It can lead to isolation, to discrimination, even violence.
It sounds like your advocacy work really touches on so many important aspects
Yeah,
of the HIV and AIDS experience.
yeah.
And, your willingness to share your story
Mm-hmm.
and to fight for change
Mm-hmm.
is really powerful.
Thank you. It's been a long journey, but I'm grateful for the opportunity to use my experience to help others. If my story can make even a small difference in someone else's life, it's all worth it.
I have no doubt that your story is going to resonate
Yeah.
with our listeners. So thank you so much for sharing your journey with us today, Guest Name. We really appreciate you being here.
Thank you so much.
Thank you.
It's been an honor.
Thank you, Guest Name, for your honesty, your courage, your commitment to making a difference.
Mm.
As we kind of wrap up this deep dive into HIV and AIDS,
Yeah.
I think it's incredible to see how far we've come.
Yeah.
From the early days when it was all fear and uncertainty
Mm-hmm.
to all these incredible scientific advancements.
It's true.
It's been a remarkable journey. We've explored the complex science, the evolving treatments, the social and emotional impact, and most importantly, the human stories,
Yeah.
that remind us why this work is so important.
Absolutely.
I think the biggest takeaway for me from all of this is the power of knowledge
Yes.
and compassion. Knowledge empowers us to make informed choices, advocate for ourselves and others, and challenge that misinformation and stigma.
Mm.
And compassion just reminds us that everyone living with HIV and AIDS deserves our understanding and our support.
Beautifully said. I hope that as we all move forward, that we can continue to learn and to advocate and create a world where HIV/AIDS is no longer a source of fear and shame and suffering.
Well said. Thank you so much for joining us on this deep dive into HIV and AIDS. We'll be back soon with another fascinating topic to explore. Until then, stay curious and stay compassionate.